Toronto announcing today that it reached the 1 million mark for getting third doses of the COVID vaccine into the arms of its residents. That's the same mark it hit in June of last year for second doses. That's about 40% of the population. And so now the focus will once again be on a hyperlocal campaign to get more shots into the areas where there aren't enough already.
Our efforts to help people in all neighborhoods, without exception, to get vaccinated, first, second, and now third doses, and children's doses for that matter, this will help to ensure that we can come back as quickly as possible and stronger than ever.
With every effort to get people vaccinated during the pandemic, there have been areas in the city that have been harder to reach. The uptake on getting shots in arms is slower. Now, a multi-pronged approach to help it along again, with dozens of clinics being set up at Toronto community housing buildings, much like the city and local health partners began doing in April last year.
Hyperlocal clinics and community-based outreach, boots on the ground in every language spoken. This is the model that has worked for us before. It's the model that enabled Toronto to become one of the world leaders in vaccination rates amongst major metropolitan cities.
Hundreds of local community ambassadors will continue with outreach in targeted neighborhoods with the help of grassroots community organizations. Larger clinics throughout the city will once again be dedicating appointments for those living in specific area codes, focused on the parts of Toronto with lower vaccine rates. It's the sprint strategy city officials say has worked before and are confident it will again.
We at Toronto Public Health will continue to do everything we can as we continue heading up the curve of this COVID-19 wave. It is important to remember that pandemics wane, and they do end.
School-based clinics will continue to be set up in an effort to get kids, families, and education workers their doses. Special community events will also host pop-up vaccination clinics in focused neighborhoods, including one for Black, African, and Caribbean communities at the Jamaican Community Association Centre this coming Sunday.
It has been a foundation principle of the way in which we've managed the entire pandemic that we've devoted special attention and special resources, as properly should be the case, to those neighborhoods facing special challenges in many respects, including an overrepresentation among those who've been infected by the COVID-19 virus.
As CityNews first told you over the weekend, Toronto's Paramedic Union was reporting that there was no crews available to respond to calls at one point. Today, Toronto's emergency officials were responding, saying that the main reason for that happening is what's called offload delays when ambulances are at hospitals. Today, they say they'll be looking into the matter further to try and find some solutions. McAllister, CityNews.